to the introductions. Speaking second, and he will have a period of 11 minutes followed immediately for him by 3 minutes of rebuttal, so that his total speaking time will be 14 minutes, is Professor Bruce K. Alexander. He is a professor in the Department of Psychology at Fraser University, located in Burnaby, British Columbia. And for those of you that have not been to Burnaby, it is a relatively large suburb of Vancouver, British Columbia. He has been at Fraser since 1970, but is well known within the Oregon community, having served for 3 years at the Oregon Regional Primate Center from 1967 to 1970, and also as an assistant professor of the Department of Medical Psychology at the University of Oregon Medical School. We all know that as OHSU now, from 1967 to 1970. Both of our speakers today have long publishing resumes, and both are anxiously awaiting the product of their work from publishers. Dr. Alexander is waiting for his book called Peaceful Measures, Canada's Alternatives to the War on Drugs, and he will be speaking second. Speaking first with 11 minutes, and then she will follow Bruce Alexander with a 3-minute rebuttal period. And if I haven't thoroughly confused you yet, would you please write down what I've just said so that I can understand it, is Katie Evans, who is an Oregon Board certified alcohol and drug counselor. She completed her undergraduate work at the University of Oregon. She has been both a counselor and clinical director for inpatient and outpatient chemical dependency treatment for both adults and adolescents. She spent 7 years working for the Children's Services Division as a caseworker. Ms. Evans is currently president of Addictions Treatment Association, which is a Northwest treatment providers group, and is also employed by Samissa Healthcare Corp. In the Northwest region, where she does program development, consultation, and training. She as well is waiting for 2 books, I'm told, from her publishers. She tells me that she had time to write the second one while waiting for the publisher to complete his editing chore on the first one, so I wish her luck. Would you help me welcome both of our speakers? First, Katie Evans on drugs, decriminalization, and demand.
Thank you. I think it's interesting, and I want to share with you before I start that a few weeks ago when I wrote this talk, George Bush had not released any information, so I thought I was quite innovative with some of the things I was going to suggest. Somehow his people saw my notes, saw what I was going to say to you, and stole some of the suggestions I have to offer today. So not to be redundant, but I want to say seriously that some of the issues and forms of solutions that have been addressed in the last week or so in the media are some things that I want to mention and expand upon. While we talk about the issues and possible solutions for the rampant drug and alcohol problem in this country, we will discuss the issue particularly related to decriminalization as a potential solution. Prior to discussing that, debating that, and offering other solutions, I'd like to begin with just a moment talking about the problem. The problem in this country surrounding drug addiction is addiction in of itself. Drug addiction is a progressive, fatal, and chronic life-threatening disease. And for people involved in that disease process, the use of drugs becomes what we call a primary urge. It becomes more important in those people than anything else in their lives, more important than their jobs, their homes, their families, anything else that they value. So before I begin, I'd like you all to take just a moment and think of the one thing in your life that you value the most. That one person who gives you emotional support, who makes you feel good, that makes you feel like you can deal with life when life isn't dealing you the hand you'd like to have. Think of that one person or thing that's most important to you. Now imagine that someone has said to you, you can never see that person, thing again, have that person or thing again, or come near it, talk about it, associate it, or have anything to do with it. You're not to go places where they are. You're not to see people who know that person. You're not to be with them at all. It's a subjective experience I'm asking you to consider right now, but remember how you feel, because this is the feeling of the addict when they're told to not use drugs. So as we begin our discussion, I'd like to remember that subjective experience because that is part of the problem when we come up with simplistic solutions such as decriminalization. The war on drugs is not failing due to ineffective solutions. It's simply not comprehensive enough. Focus has been laid most heavily in the area of incarceration of drug traffickers, the suppliers of drugs. I feel that we need a more pragmatic approach. While we certainly have issues regarding suppliers, we have an issue regarding product demand. For us to have a comprehensive approach, we need to address both supply and demand like we would in any marketplace issue. We have customers whose demand for drugs and alcohol far exceed the supply from time to time. To consider the incredible demand for drugs in this country, consider this, that 25% of all Americans, 1 out of 4, use illegal drugs at least once a year. 1 out of 4. Of those individuals, 1 of those 4 people are addicted to drugs and alcohol. And I think it would be fair to assume that that 1 person probably uses more drugs or alcohol than the other 3 combined. So when you're talking about demand for drugs and potential solutions, consider how widespread this issue is. An effective drug policy and solution to these issues needs to address this issue of demand. We need to be able to address it through funding and other resources to help people who are addicted. At a local level, we can certainly understand the problems the drug and alcohol abuse has had on our city. I grew up in Portland, and Portland is not the city today it once was. Portland used to be known as a city where we could come for a quality of life. Now I can be in other parts of the country speaking and listen to how Portland is known for drugs, crimes, and gang problems. It's no longer the city of roses in people's minds outside of this area. While politicians are known for trying to address this solution in the form of political rhetoric, few of them offer solid solutions as to exactly what we're going to do about it. DePaul Center in Portland is one of the only few residential indigent programs we have in this state, and it usually takes from 4 to 6 months for an addict to get into that program. For those of you who are familiar with addiction, you understand that people don't wait on a waiting list for their name to come up, that when you're ready to get help, you need help now. Oregon Medicaid currently doesn't fund drug and alcohol treatment. In a study that we recently did for Addictions Treatment Association, we discovered that people trying to get into our inpatient programs, that 25% of them were recipients of Oregon Medicaid. And yet, when discussing these problems with Adult and Family Services, they seemed to feel that they didn't have a problem, that they no longer allowed people who are chemically dependent to receive Medicaid. Again, we were looking at the problem through the wrong end of the telescope. Our state is paying for the effects of chemical dependency through traffic fatalities, medical problems, also through the issues like child abuse. Oregon State Children's Services reports that 80% of the child abuse cases are involved in drug and alcohol use. So when we start to consider the vast problems associated with this and implementing solutions, we need to remember what all of this means, because decriminalization is not the solution to these problems. Those advocating for decriminalization have abandoned hope. Changing legalization only changes the supplier of drugs and alcohol. It doesn't change the problem. Alcohol and nicotine have been legal drugs in this country for many years, and they are the largest killers of people as far as these chemicals go. A friend I recently spoke to mentioned to me that there are 4 plane loads of 747s a year that crash, equal to the number of people who die as a result of nicotine and alcohol addiction. Only one small 737 would hold all of those who die a year from illegal drug abuse. So our illegal drugs in this country, our legal drugs rather in this country, are as much of the problem as the illegal substances. Those who advocate for decriminalization are trying to redefine the problem. Drug use in this country is due to demand for drugs. It's not a supplier issue. That if Americans no longer demanded these items, the money to be made in profiteering from supplying them would diminish. Advocates of decriminalization are simply trying to change the supplier. The supplier no longer would be the Colombians, it would be the OLCC. Instead of having your cocaine brought to you from Colombia, you could purchase it at the OLCC. However, the addiction would remain the same. The medical, social problems would remain the same of the addict and those in their environment, family members and significant others. It's important to understand denial as we talk about addiction. Not only denial from those of us who are afraid to deal with this incredibly overwhelming problem, but denial from the addict themselves. One of the main ways those of us working in treatment deal with denial are consequences of use. You can look to a person who's addicted and say, look at your life. You've been arrested 14 times. You have problems. Legal sanctions and laws related to chemical dependency are one of the main reasons people get help. If we decriminalize drug use, we have reduced and eliminated one of the main reasons why drug addicts seek treatment in the first place. Remember when I started this talk and we said, give up the one thing you care about the most? A drug addict, for short of staying out of jail, isn't going to volunteer to give up the one thing they love the most. If we decriminalize drugs and remove the legal restrictions, then there's no longer those barriers. So it is our belief that addiction will become even more rampant and widespread than it is today. Addiction in this country is devastating our productivity and breaking down our society. Serious problems require serious solutions. Decriminalization smacks of an unrealistic and irresponsible approach to deal with this life-threatening disease. So I've spent some time saying why I don't believe decriminalization is the answer to this problem. Here are some other suggested solutions that I think we might consider instead. First, for the 1 in 4 of us who are choosing to use illegal drugs, we need to stop. If you're not caught up in a cycle of addiction and are choosing to use and abuse illegal drugs, then you're part of the problem and you need to stop. Secondly, treatment needs to become broadly available to all addicted people, not just those people with excellent insurance or money in their pockets. Public funds need to become available to pay for treatment for low-income and indigent people. Thirdly, for those of us middle-class people, insurance companies need to do their fair share and recognize it as a treatable disease. Those of us who are in business, who have employees and purchase health insurance as part of our package need to insist that adequate coverage is there for treatment of chemical dependency. Our state laws need firm consequences for drug traffickers and strong efforts towards rehabilitation of drug users. We need to develop job programs for low-income youth. Currently, the only future these children see as income-producing people are drug dealing. They have role models in their neighborhoods of people who are successful because of their drug dealings. We need to continue to develop our school programs and sober activities and identify and refer impaired youth. Finally, we need to lay down our differences politically, of sex, race, and religion, and put them to rest so that we can make a difference. We need not abandon hope. We need to get together and fight this illness of addiction. Thank you.
Thank you, Katie, and now Bruce Alexander.
Thank you for the kind introduction, and thank you for inviting me to your beautiful city. I'd love to come to Portland. And thank you for giving me lunch. I don't want to represent myself as speaking for Canadians on this issue, because Canadians, like Americans, are fractured on this issue and think all kinds of different things. I do want to represent myself as speaking for a small group of Canadian and European and American scholars who are concerned that the war on drugs has become a monster. I'm a member of the Drug Policy Foundation, which is headed by Arnold Trebeck in Washington, D.C., and a European organization called the Anti-Prohibition League, which is concerned that the war on drugs has become a kind of madness. I could respectfully give a short list of both of the things that I agree with in Katie Evans's talk. Number one is that the present situation is intolerable and some sort of change must occur. And number two is that the answer is not some kind of blanket legalization of drugs. I would like to suggest five truths, if you will, or five understandings which are coming to the fore now. And the first couple of these, I think, will be ones that have really been accepted widely. But as I go through the list, I'll get to more difficult ones which have not yet been accepted widely, but which I would like to suggest will soon be, as this problem is more thoughtfully discussed and more thoroughly studied. The first point I'd like to make is that the war on drugs is not a new thing at all, even though President Bush talked about the new national strategy for the first time. There have been new national strategies on the war on drugs in this country and in my country for many years. Really, the war on drugs as a unified national issue goes back to the beginning of the century with the prohibition of opium and cocaine and later alcohol in both of our countries. The war on drugs is, in fact, a very old idea. It goes well back into the 19th century as well. The rhetoric of the temperance movement in the 19th century was warlike in the extreme. People were saying things about whiskey and beer in the 19th century which are not distinguishable from what is now being said about crack. The war on drugs is a very old idea. Second is that I think that most thoughtful people are now coming to agree. I think a kind of a consensus is emerging that drug prohibition, that part of the war on drugs which has to do with actually physically preventing people from using or selling drugs, has failed. You simply can't do it in any sort of affordable way. One needs look no further for evidence than to American alcohol prohibition or Canadian alcohol prohibition, which followed the same course. And I won't say much more about that. Incidentally, I will not try to bombard you with statistics or historical incidents, but I've come armed with a briefcase full of them, and if anyone has any questions that they would want more to deal with more specifically afterwards, I'd love to do it. The third generalization I'd like to make is that war, not only the war on drugs, but war is much more than an act of violence. Most American soldiers, for example, don't carry weapons. They do other things. They run computers and they work telephones and so forth and so on. War is a very, very complex endeavor. As well as killing people, it also involves supply and propaganda. It involves a change in civil rights. Civil rights are always restricted during war. In Canada, we have this all spelled out in the War Measures Act, which says all the civil rights. It enumerates the civil rights which are lost automatically during war. War also entails spying. It involves informing. In other words, I can continue this list. The point is that there's a war mentality. There's a way you think during wars. Things become comprehensible, things become possible and acceptable during wars, which would be unacceptable and unthinkable at other times. I think it's fair to say that during war, normal human intelligence and compassion is always replaced by rigidity and ruthlessness, I suppose, or mercilessness in the goal of achieving victory. Point number 4 is that the war on drugs includes all the things I've mentioned. It is a war. And that treatment, and prevention have been part of the war on drugs from the very start. What I'm trying to suggest here is that we cannot get out of the war on drugs by replacing prohibition with treatment or replacing prohibition with prevention, because those things have always been part of the war on drugs. You may know that Benjamin Rush, who signed the Declaration of Independence, invented really the modern use of the term addiction as applied to people who use alcohol. He first called them addicts, and he, of course, was a doctor and recommended treatment. And his treatments for alcoholism included whipping, bleeding, which in those days was a very serious, heroic measure, the use of drugs to make people vomit to the point where they wouldn't touch alcohol anymore, and so forth. The war on drugs has always involved treatment, and it has always involved treatment of a special sort, an extreme form of treatment, so that we have civil commitment laws in Canada and the US which enable people to be put into treatment who don't want to be treated, and to be incarcerated and kept there indefinitely, even if they have no identifiable disease. They don't have to be even addicted. They can simply be drug users, or they can be addicted. Prevention has always been part of the war on drugs. Now prevention is an ambiguous word, but if by prevention you mean something like telling terrible stories in order to scare people from using drugs, that has always been done. And if you want to read something of interest, which I just found last week, you could read some of the school books which were prepared in the 19th century by the Women's Christian Temperance Union and were used widely in schools in this country and in Canada, which are full of things which we would all know to be lies about alcohol. This was part of the prevention campaign of the 19th century. And there are many other examples, but I don't want to waste my 14 minutes on just that. My fifth major point is that neither prevention nor treatment works any better than prohibition in terms of dealing with drug problems. And here I won't try to list the literature, but these things have been studied extensively. Wherever there are good, careful statistical studies, the indication is that treatment doesn't work. And I say this with respect. I know some of you are in the business of doing treatment. It doesn't mean, of course, that people can't help people who are in need, but it means that treatment, especially forced treatment, but also treatment within large-scale bureaucratized institutions, which is kind of forced on people who don't really want it, doesn't work, and that's well documented. Prevention doesn't work either, and that's well documented too. The best example and best documented example is the use of glue in the United States, where the use of glue went from a tiny problem that affected very small numbers of people, isolated children, to a national issue in the 60s, primarily because of prevention. That the newspapers and the television simply started blaring out messages which of course convinced huge numbers of adolescents that sniffing glue was something they should try if they wanted to have a bit of a thrill and so forth, and they did in large numbers. Prevention is not effective either. How can we end the war on drugs? What I would like to say, if you accept this as a context, is that when we talk about this drug issue, we're not talking about a new problem at all. We're talking about a problem that's been about 200 years in the making, and we're not going to get it out of it very fast. It's going to take a good long time to get out of it. Generations have been trained in the propaganda, if you will, of the war on drugs, and it takes a long time to overcome that. I would suggest that the way out of this dreadful situation is precisely what is in the process of happening now. That is, it's a time when people must make it a public issue, when it must be discussed, and when in the process of that, what I feel will happen is that new understandings will emerge. And I want to suggest two of these understandings which I think will emerge. And you may think of these perhaps as new ideas, but I think if you think of them more carefully, you realize that what I'm about to say is just absolutely, totally obvious. One of the functions of wars is that the obvious is denied. So I want to say some things which may strike you as new or may strike you as obvious. One of them is that the problems of the United States and the problems of Canada are not in any significant measure caused by drugs. Drugs are not a significant cause of violence or sickness among babies or traffic accidents or economic disaster, any of these problems we talk about. It's simply a convenient oversimplification that we perhaps all cleave to because it gets us off the hook. But these problems have very, very deep roots and require a great deal of attention. I saw a television show the other day which almost drove me off the wall. I almost lost it, as they say. I saw a television show which argued that cocaine was responsible for the destruction of the Amazon rainforest. And I looked out my window. I happened to live close to the water in Vancouver, or in Burnaby, at enormous log booms out there. You can go almost anywhere where I live, and I believe you can go almost anywhere around Portland, and you can see the destruction of the rainforest. I mean, the corpses of the trees are laying out there in the river. The same thing is true in South America. The rainforest is, of course, being destroyed. Of course, it's a tremendous catastrophe, but it has almost nothing to do with cocaine. It has a great deal to do with coffee, has a great deal to do with meat, and it has a great deal to do with suburban housing, but very little to do with cocaine. The first understanding which I'm proposing is that if you analyze these problems carefully, look at American blacks. Violence and despair among American blacks does not come from crack. And everyone who takes the trouble to think about it for a while will know that that's the case. It's obvious. The roots of that problem are very deep. If you accept that, excuse me one second. How much time do I have? Okay. If you accept that as a principle, the alternatives to fighting a war on drugs emerge relatively easily. If drugs are not the cause of the serious problems, then of course you can't solve these serious problems by controlling drugs. That, of course, does not mean that you legalize drugs, because drugs, like automobiles and gunpowder, are dangerous kinds of technological artifacts, and of course they must be controlled in reasonable ways. It's possible for the state of Oregon to have a partial decriminalization of marijuana and to keep other drugs illegal. And that probably makes a great deal of sense. Because if that grows from the feelings of the people of Oregon about what drugs are proper and what drugs are not proper in Oregon, there's no reason why drugs can't be regulated. What's gone wrong is the imposition of a national and international regime which says that all the drugs on this following list are to be prohibited in the entire world forever and by everyone. That's war. That's not regulation. Normal regulation of drugs is simple to conceive of and perfectly practical. The second major understanding is this, and I will have to say this very quickly. Drugs don't possess people like devils. People use drugs, and I know lots of people in my work as a psychologist who use drugs. People use drugs in the same way that people use cars and people use television sets and people fall in love. People get involved with powerful experiences, and drugs are among them, but the drugs don't possess them. I once asked one of my classes, what do you know besides cocaine that supposedly grabs people and possesses them and won't let them go once they've experienced it? And the students thought about it for a long time, and maybe you'll think about it for a fraction of a second here. I don't think there's any answer to that question other than the devil. The way we talk about drugs is the way we have characteristically talked about the devil, and we have to stop doing that. We have to demythologize this problem. Thank you. I'm sorry I went a little overtime.
Thank you, Bruce. And now with a 3-minute rebuttal, back to Katie.
Well, I did find something I agreed with in your discussion, Dr. Alexander, and that was that the previous forms of treatment, aversion therapy with vomiting, leeching, and other types of chaining people to the walls is not the preferred type of treatment today, and I imagine it was quite unsuccessful. Today, treatment is comprehensive, and I would argue with you that research does support that treatment is successful, appropriate treatment for appropriate disorders. Also, I'm struck by this analogy, that some of the analogies that were being made I thought are very interesting, but one that comes to my mind is the analogy of cancer. When Dr. Alexander was talking about how prevention doesn't work, I started thinking about some years ago when the large number of Americans smoked cigarettes, and the campaign that went throughout this country on how smoking is harmful to your health. And I guess I would draw that a correlation here, that I think we had quite a successful campaign which led half of all Americans to stop smoking who are currently addicted to nicotine at the time. We could say that the cancer wasn't the problem, that this cancer was consuming them, and they somehow it was outside of them. But I think that it suggests that the prevention model does work, even with addiction, nicotine addiction. The other thing that's come to mind recently in this state is that we've really firmed our drunk driving laws. And for those people who have choice about drinking and driving, and I refer to those people who are not addicted to alcohol or other drugs, the number of drunk driving incidents have gone down, and we can see that our culture has changed regarding the Friday afternoon get drunk till you drop practices of business in our community have changed as a result of those laws and a result of our society taking a better look at what we're doing. And I guess that I would just like to summarize in thinking that a lot of the points that you're making, while very interesting, tend to redefine the problem. That the issue is not that drugs are bad. Drugs are not going to jump up from behind this curtain and grab us all before we leave the room. Drugs are a symptom of addiction. Addiction is what are killing Americans and causing problems in this country. And to not address the disease of addiction that is the driving force of bringing illegal drugs into this country is simply missing the point. Thank you.
Thank you, Bruce and Katie. I'm glad to see you have so many points upon which you agree. We are now into the question part of our program. We'll have a microphone somewhere in the center of the room shortly. And if you do wish to present a written question, there should be a form on your table. Please hold it up in the air so that the staff can pick it up and bring it forward. Our first question today is from our board host, Pamela Rapp.
Thank you. I'd first like to thank both our speakers for giving such thought-provoking remarks. I have a question for Dr. Alexander. It appears to me as a non-professional in this area of drug treatment and drug use that reducing demand is ultimately going to require that people believe it's not in their best interest to use drugs and that public opinion is against it. Given that, or if you agree that that is true, wouldn't decriminalization take some of the pressure off helping that attitude grow, foster, and come to fill our minds?
I think the question is that the decriminalization would help reduce demand by making drugs less of an adventure. I just want to be sure I understand your question.
The question is whether it won't reduce pressure for believing that use of drugs is not an acceptable practice.
Okay, you're saying that decriminalization is a bad idea because then people would think drugs are okay.
Stated very simply.
Sure. I mean, yeah, I agree. If you decriminalize drugs, then people will start to regard drugs in the way they regard other things. They might start to regard them the way they regard automobiles or games or video games or any of those things. And then you might be in a position to explain to them. They might start to regard them, for example, the way they regard cigarettes. Now, I'm not trying to say that cigarettes aren't drugs, but I'm trying to say that cigarettes have not been part of the war on drugs. We have not made cigarettes illegal. What we have done is succeeded in reducing, as Katie Evans points out, we've succeeded in reducing the amount of cigarette use dramatically and effectively, and very importantly, without illegalizing it. And that's the model I mean to make, that you can talk about something in a very serious way. You don't need to make it illegal. You do not need that symbolism. The cost of that symbolism of making it illegal is very high. That's the point, and doesn't add anything to the message that you would otherwise give. You can tell people cigarettes are terrible. You don't need to make them illegal for them to understand what you've meant. And by the way, my argument is not one for decriminalization at all. My argument is simply that people ought to decide. I think Oregon is a place I admire because Oregonians have had some referendum which have established their position on marijuana. Well, I think that's a perfectly reasonable way. If Oregon partially legalizes marijuana and Alaska legalizes it all the way, as it has, for personal use, and if Idaho decides not to legalize it, all that makes perfect sense to me. It seems to me people should be able to decide what kinds of drugs are acceptable in their community. That's part of what communities do. They define what's acceptable in that way. What I'm arguing against is a massive national, international war.
Katie, do you want to add anything?
Well, I think the point that is just made is clearly that laws do dictate cultural values in a society, and if we have ambiguous or unclear messages about the use of a chemical, then we will continue to have an ambiguous and unclear message about the use of that chemical. And I think that the laws give clear structure and guidelines, and I think it's a artificial distinction to draw a correlation between the use of automobiles and the use of heroin, crack, or cocaine.
Yes, sir. Please introduce yourself, if you would.
My name is Rich Pope. I'm a member, and I'm fraught with choosing one of a multitude of questions. Ms. Evans, you suggested that the fear of arrest is one of the stimulus to get individuals to come in and seek treatment. And yet there are only about 750,000 arrests for drug use or abuse in this country yearly, about 2% of the number of users. The police probably do a better job than that on a random basis. Would you discuss the alternative, that if drug abuse was not illegal, you might get more people seeking treatment?
I appreciate that you asked that question because somehow my point I escaped. The point I was trying to make in discussing the arrests of people was that it wasn't the fear of arrest that promoted people on the arrest itself. The arrest itself allows a person a consequence, a real life, right in your face, going to go to court consequence of their use of drugs and alcohol. When faced with this consequence, most addicts experience a moment of truth that breaks through that window of denial that says, no, not me, I don't have a problem. And so the arrest itself, the fear of arrest, propels many, many addicts into treatment. And so that would be my response. I think that treatment is obtained often with the help of the criminal justice system in this state.
Bruce, do you want to jump in on this one?
No.
Austin Leach City Club. My first experience with drugs was about 60 years ago. My father was an MD, and it seems like every 2 or 3 weeks he would come home, and I could overhear the conversation between him and my mother. Those damn dope fiends broke in my car again and took my pill bag. That made an impression. Made an impression, too, that I know that on some nights, say per month, Mother would take small bed pills and put them in another vial in his medicine bag, and they were placebo. There were certain things that he could give a placebo for, encourage them to know that they're going to feel better tomorrow, and they would. Question: do you know of any work being done now on a chemically related placebo that could be used with these people that would help relieve this other chemical dependency that they have and help them not or overcome addiction? Question mark.
Is that for me?
I'll take a stab at that first, if I may. There's a great deal of research along those lines that's underway, but none of it has been successful to my knowledge. I think there is nothing of that sort.
I would respond to that one of the issues here with the placebo effect is that you have people that are physiologically dependent on drugs, and there's effects from that process in and of itself. And part of the problem is the physiological dependence. What you're addressing is psychological dependence, which is only one facet of addiction.
Yes, sir.
Jay Renau, City Club member. A question for Ms. Evans. We, of course, no one could predict exactly what legalization or decriminalization of drugs might exactly bring, but we do have some historical experience. Under certain circumstances, the powerful opiate drug methadone is prescribed to people, accessible to them on a legal basis. Ms. Evans, would you be willing to share any experiences that you might have had from a clinical point of view with addicts who have been subjected to treatment by methadone?
My experience with that particularly is that the folks who are receiving this legal substitute for heroin, which is what methadone is, do not demonstrate a strong positive treatment outcome. In other words, their relapse rate back into heroin use or on other chemicals is quite high, that having this legal drug in their system seems to prevent them from being able to totally appreciate and comprehend a treatment program as intended to be prescribed.
If I can add something to that briefly, I do a great deal of work with people who are taking methadone, and I essentially agree with what Kitty Evans has said. I don't think methadone can be a major part of the solution to drug problems. It is helpful for some people, and some people have, in fact, left heroin addiction behind and moved over to methadone addiction, but they're still a bit stoned out most of the time because it is quite a powerful substance, and a good many other people don't fare very well on that treatment anyway. I don't think it's an important part of the solution.
I have to gather my thoughts again. I was listening to your answer rather than thinking about my question. As a Vietnam-era veteran, I'm familiar with the face of war. And usually in war there are victims, people who die. And currently the people who are dying are those who are the people who use the drugs. If you decriminalize and you legalize, we're going to have an increase in the number of victims, as I see it. Also, we're going to have a more philosophical point of view of bringing people in for care. What I'm driving at is, one, they're going to be exposed to control, whatever the control is, so that you can look at them and say, you've got problems, do you realize that? Here's your drug. Whereas now we don't do that, we just let them get their drugs in the back rooms. How many people, my question is there any estimation of the number of fatalities or victims that we would have if it was decriminalized or made legal? You know, what's our body count?
There are many estimates, and none of them are credible. I mean, no one can know. There is one hard fact which I think should be considered, and that is that Arnold Trebek wrote a book in 1987 called The Great Drug War, in which he accused USA Today of having lied deliberately in saying that there were, now my numbers may not be exact here, but USA Today apparently said there were 264 deaths due to crack in the first half of 1986. Arnold Trebek publicly accused them of lying, saying that the number was far smaller than that, but could not be determined exactly. He made a libelous statement. He said they knowingly lied, but was not sued for them. by them, because, I submit, they couldn't sue him because the kinds of numbers which are tossed about drug deaths are, for the most part, gross exaggerations, and they're revealed, most of them only years later. There's a very good book now which takes apart some of Nelson Rockefeller's claims about drug deaths in New York City in the late 1960s, and shows that he was off by a factor of 100. But it couldn't be shown at the time because the data weren't there. He was just making it up. I don't mean to say that people don't die who use drugs. Of course they do. But I do mean to say that if you check it historically, you will find a amazing history of distortion and exaggeration about the amount of deaths that there have been associated with drugs, and that it's going on right now. Therefore, the answer to the question of can anyone estimate how many people will die if the drugs are legalized, I don't think there is an accessible answer to that question. The facts are not available. If I could add another brief point, it's another good exercise that was suggested, and that is to total up the victims of the war on drugs. I would submit that if you do it as carefully as you can, you'll find that most of the victims are not people who have died of overdoses of drugs. I suspect that you'll find that most of the victims are people in hospitals, many with terminal cancer and other terrible conditions, who haven't been able to get the drugs they need because of fear of prescribing drugs. I think you'll find that many of the victims are people with a fairly minor habit of using drugs now and then who've spent months and years in jail for doing it. And I think you'll find also among the victims police, large numbers of police who suffer from incredible stress, really, facing the kinds of corruption possibilities which are thrust at them, and facing the fact, as much as they are able to face it, that they're trying to do something which simply can't be done. I think the victim analogy or metaphor is really a very good one to pursue here.
I'd just like to briefly respond that I think there are numerous victims of drug addiction other than the addict themselves. The survivors, the people who are killed in traffic fatalities, and other innocent bystanders who, even on our own streets of Portland, may be gunned down because of gang involvement with illegal drugs. I also want to mention that we do have data regarding our legal drug alcohol and the fatalities involved with that. And I want to keep reminding us that 80% of all suicides and 50% of all homicides are alcohol related.
Yes, sir.
My name is Bill Connerly, City Club member. I'd like to know if it's accurate to make this distinction between the drugs we have made legal and those we've made illegal. It seems like the harm caused by the legal drugs, such as nicotine and alcohol, weighs most strongly on the user and the user's family, but that the harms that result from illegal drugs are scattered broader. Were the victims of burglary, robbery, innocent victims of drive-by shootings. Would it be accurate to say that if we legalized some of these drugs, the harm would become more narrowly focused on the user and his family and way less heavily on those of us who are non-users?
Go ahead.
Yes or no question?
May I say first that the word legalized here is a very difficult one. It seems to mean not having any regulations on these things. And if that's what it means, it's crazy. I mean, we don't have anything that's legalized in that sense. Potatoes are not legalized in that sense because of the various regulations which involve pesticides and so forth that are involved in getting potatoes to market. But if you mean by legalized, you mean provided in some sense, in some reasonable sense that makes sense in various communities who decide to distribute these things. Yeah, I think the answer to your question is a definite yes. because of course all of the paraphernalia of war would be removed, and it's those deaths that we were talking about, gangland deaths and so forth. Those have nothing to do with the drugs, of course. Those have to do with the war on drugs. Drugs don't cause people to go out and shoot each other, but wars do, and that's what's involved there. The other thing that really must be repeated is that, of course, most of the people who use any drug you can name, with the possible exception of tobacco, use it moderately and don't do any harm to themselves at all, or at least not any that's worth mentioning. That's as true of cocaine as it is for marijuana, as it is for alcohol, as it is for, as I say, just about every drug with the possible exception of tobacco.
Yvonne Levernoy, City Club member. My question is addressed to either one of you. In terms of how we have approached healthcare and medical care, we have been somewhat focused on symptom treatment. And I agree with what you're saying in terms of the problem is really addiction. And what I'm interested in understanding, do you think enough is being done in terms of looking at the problem and a cure for the problem, such as what we're doing with AIDS, versus just symptom treatment?
I would be happy to respond to that. I think that we need to begin to take a more total focus on the issue of treatment and comprehensive treatment. It would be wonderful if insurance policy would reimburse preventative care, high-risk care. We have learned a lot about the field of addiction in the last 10 years, and if we were able to provide those type services, I think we may not be dealing with just the acute symptoms that we oftentimes see now.
I would just like to say that I think the whole concept of treatment has to be re-examined dramatically. I don't see that there is a disease involved here, and a great many people who are professionally involved with the study of addiction have that same feeling. It is not a foregone conclusion that addiction is a disease of any sort, and therefore the concept of treatment is problematic.
Yes.
Question for Katie Evans. I'm Ann Gardner, club member. In your list of solutions, you suggested that we develop job training programs for young people. Can you suggest any job programs that would in any way generate incomes that would compete with the financial incentives of drug dealers?
Boy, I wish I could. I would be working there, I'm afraid. That is one of the serious flaws in this problem, is that, and I have to agree with you on that. But there are some things in working with young addicts, this is an issue that comes up in treatment all the time, is that you have a young woman who's been prostituting and distributing drugs at the sum of $400 a day that she receives. And as counselors, when we tried to convince her that Burger King is an option, it's tough. It's a tough issue.
Bruce, do you want to deal with that one?
I'm Mark Stuyck, a member of the City Club. I come from perhaps a different angle, having practiced medicine for 35 years around here. And I remember in my boyhood antedating a previous question to the enactment of the Harrison Narcotic Act in 1912, when I was alive and a young boy. I remember old ladies down the street, and I knew the local doctor quite well. And these old ladies were living happily on a little bit of tincture of morphine, which cost less than aspirin at the time. And when the Harrison Narcotic Act made drugs an actual crime, it was like making smallpox a crime or any other disease a crime. And from it grew this tremendous economic problem that we're facing today, and it's been facing us just like we're just getting over the prohibition troubles. And now we have the narcotic problems, which are longer lasting. I wonder what you have done considering this not a crime to have drugs, but to consider it purely as a disease that needs to be cured at whatever expense. And that when you remove the criminal side, you remove the cost side eventually if you put enough effort into it. I'd like to have your comments.
Well, my comment would be that I think the tragedy of the Harrison Narcotic Act is very well summarized in what you've just said. It was a tragic beginning. My feeling is that the answer is not really in redefining the problem as a disease. because the medical concept and the criminal concept have arisen together. Without trying to give a history lesson here, you might know that 200 years ago, excessive use of drugs was considered neither a crime nor a disease. That those two concepts arose together, and they're intimately related. I think that really people had it right 200 years ago, in which there was a whole different way of analyzing it, and I think ultimately we may regain that.
I guess I would like to reiterate that I strongly disagree with Dr. Alexander, obviously, that addiction is a disease and requires medical treatment for that disease. Secondly, that the issue of decriminalization, as I mentioned earlier in my talk, allows a consequence for use and allows a person a chance to see. The addiction itself, the disease, is not what's breaking the laws. It's the behaviors associated with the disease that are quite often illegal. Most cancer victims aren't running people down on the road and running people over drunk and breaking into other people's homes, which is often common in the disease of addiction.